All right, I think we should go ahead and get started. Welcome, everybody. Hopefully everybody can hear us. Cindy, Amy, we had tried to test you. If you could say something to us in the chat feature or in the question and answer feature, just to make sure that we have you on audio, we would love that. My name is Michelle Lane, and I am the Senior Director for Community Health and Wellness. And despite our technical efforts, we've got some really good information for you today. So our speaker is Kristi Cavanaugh. She is the program manager for our cardiac service line here at North Kansas City Hospital, and just an amazing human. I have been lucky enough to work alongside with her for years, and she has a plethora of information to share today that is super user-friendly. And I'm going to go ahead and give it to Kristi. So take it away, Kristi.
All right. Well, thanks everybody for joining. I guess I should say good afternoon. I felt like saying good morning. But yeah, thanks again to everyone who's logged in and either attending this event live or watching the recorded version. So for those couple of you who are on live, if you like what you hear or you learn a little something today and you want to rewatch or share this presentation, the recorded link will be posted on the hospital's YouTube channel and then shared on the nkch.org website in the next few days. So as Michelle said, I'm Kristi, and I'm the cardiac program manager at the hospital. And one more quick housekeeping thing, since this is a virtual recorded session, instead of it being interactive, I'm just going to work through the slides. And then at the end, Michelle will open it up for questions. So you might think of questions as I'm talking, and you can either enter them in the chat or write them down so you don't forget to ask at the end. So first, just a little bit about me, and then I'll talk about this first slide. I've been a nurse at North Kansas City Hospital for my whole career. I actually started working here when I was in nursing school and worked as a nurse tech or assistant. And then post-graduation, I've worked in various different nursing roles throughout the hospital. Most of my time has been spent in the ICU and the recovery room for surgical patients. But I have also worked a few other places. And I'm not sure I have to say this, but I don't have any financial disclosures except for that I do work for the hospital. And I'm very proud and honored to say I have now been in this role as cardiac program manager for almost 2 years. So I would have always in the past, up until this role, described myself as a critical care nurse. So in the past 2 years, I've had a lot to learn about cardiology. And I still have a lot to learn as there's always new studies and research being done. So this slide, first slide, shows why I'm so proud to work at North Kansas City and represent our cardiac program. So here at North Kansas City Hospital, we are certified by the Joint Commission and the American Heart Association as a comprehensive cardiac center. And we have had that since 2020. And we've been considered a level 1 STEMI center by the state of Missouri for several years prior to getting this certification through the Joint Commission. So there's our little certificate we have through the Joint Commission. And I just want to say that the Comprehensive Cardiac Center is the highest level of certification that a hospital can receive for cardiac care from the Joint Commission. And some of you guys probably recognize Joint Commission as the accrediting body for hospitals, but they also do have these specialty certifications that you can get. So this one encompasses all aspects of cardiac care, including acute MI patients or patients that are having heart attacks, heart failure patients, interventional cardiology procedures, including pacemakers and ICDs, cardiothoracic surgery patients, including open heart and valve replacement or repair surgeries, and then also extending out to our cardiac rehab outpatient care. And then a level 1 STEMI center from the state of Missouri is also the highest level that a hospital can achieve for care of our STEMI or heart attack patients. And because we have the comprehensive cardiac certification through Joint Commission, the state of Missouri recognizes us as a level 1 STEMI center. So it's kind of a reciprocal designation by the state of Missouri. And then also I included this nice little thing that we got from the U.S. News and World Report. It recognizes us as a high performer in heart attack care, heart failure care, and aortic valve surgery. So my job as the cardiac program manager is to work with all the cardiac departments, including the emergency room and our EMS ambulance partners and the community, to make sure we meet all the requirements to keep these certifications. So first, I'm going to start with some statistics. So heart disease is still the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. One person dies every 33 seconds in the United States from cardiovascular disease. And this little graph shows the prevalence, or this map shows the prevalence of heart disease in the United States. From 2018 to 2020. So it was the most current one that the CDC had on their site. And I just wanted to kind of point out here where we're at here in the center of the country in Kansas City. We are in a little bit of a higher prevalence area. And you can see that the higher prevalence is really kind of right here in the Midwest and southern states of the country. My family, when I was showing them the slides, pointed out how the coastlines here tend to stay a little healthier, and maybe that's because the weather's a little nicer and they get out. But then you've also got Colorado and Minnesota. Those states tend to be populated by some people that are maybe a little more outdoorsy and get out and are a little more active. So Kansas City, we've kind of got a little work to do in our area. And I will mention that this slide says that heart disease is the leading cause, but there are several types of heart disease. But for this talk, I'm going to focus on heart attacks and reducing your risk of having one, because for most people, that is generally the thing that they worry about the most or scares them the most. So some more statistics. In the United States, someone has a heart attack every 40 seconds. Every year, about 805,000 people in the United States have a heart attack. Of these, 605,000 are a first heart attack, and the other 200,000 happen to people who have already had a previous heart attack. And then about 1 in 5 heart attacks are silent. So the damage is done, but the person is not aware of it. And those silent heart attacks are usually very mild, but can still cause some damage. And that damage may be detectable on future cardiology studies or on EKGs that you might have. So then we'll talk about some race, ethnicity, gender, and age differences. So the top is race and ethnicity. African Americans are still in the highest risk group for cardiovascular disease. And African Americans are twice as likely to die from heart disease than Hispanics. And then talking about gender, so between 70 and 89% of sudden heart attacks are experienced by men. Women are more likely than men to have heart attack symptoms unrelated to chest pain. Now, if this were a live presentation, I would usually ask somebody in the audience if they knew why that is for women, that men are more likely to be the sudden heart attack. And actually, I'll go ahead and read this little block down here about age. So men aged 45 and older and women aged 55 and older are more likely to have a heart attack. So it occurs a little bit later in women. And so then that would be where I'd ask my question if anybody knows why that is. But since it's just me talking, I'll go ahead and say that it's because of our estrogen, and we're actually somewhat protected by that until we go through menopause. So it's just something to be aware about as a woman, that if you've been through menopause, you are now at a higher risk for heart disease. Fun times, right? Okay, so then we'll talk about the types of heart attacks. And there are many different types of heart attacks or areas of the heart that can be affected by a heart attack. And then you'll hear me and see a lot of technical or medical terminology, but I'll try to always say stuff in layman's terms. So heart attack is more of a layman's term. And then the medical terminology is a myocardial infarction, or for short, you may hear the acronym MI. And then the two main types of heart attacks or MIs are a STEMI or an NSTEMI. So a STEMI or an NSTEMI. So the STEMI is the ST segment elevation myocardial infarction. Nice little acronym. And then an NSTEMI is just a non-ST segment elevation myocardial infarction. So we can tell the gold standard for telling if you're a heart attack is an EKG. So you'll see here, this is a normal EKG reading, and you'll see here pointing to the ST segment. And it really should be right down about on what we would call baseline. So if you're having an STEMI, we see this ST elevation, hence the name ST elevation. If you're having an NSTEMI, you can have changes in that ST segment. It can be depressed, or this little T wave can be inverted. And so the difference between the STEMI and the NSTEMI is the STEMI is the more serious heart attack. The patient is most at risk if they're having a STEMI. And the NSTEMI is a milder heart attack. It may be just a partial occlusion, and we would still want to admit you and get you to the cath lab fairly quickly, but not as quick as with a STEMI. A STEMI a lot of times means that one of those coronary arteries is 100% occluded. So we want to get you to the cath lab really quick if you're having a STEMI. So how can you spot a heart attack? So this is a nice little magnet that we give out at some of our community events that lists the most common signs of a heart attack and spell out a nice little acronym of ACT NOW. And then I will point out, it lists out all the most common signs of a heart attack, but our cardiologists, when they saw this magnet, they really didn't like it because it lists arm pain first, and that is not the most common sign. The most common sign is chest pain, discomfort, pressure in the chest. And then the second most common actually would be the nausea, lightheaded, nausea, vomiting, maybe some diaphoresis or sweating in layman's terms. And then after that would come jaw, neck, throat pain, followed by arm pain. So it's actually like the fourth most common. But again, you might have all 6 of these symptoms, or you might just have one. And the most common one you would have would be the chest pain. And this next slide from the American Heart Association website actually lists out the frequent signs and symptoms in the most common order. So for number 1, they do say pain or discomfort in the chest. Number 2, lightheadedness, nausea, or vomiting. Number 3, jaw, neck, or back pain. Number 4 is the discomfort or pain in the arm or shoulder. And number 5 would be shortness of breath. And then again, the other one I talked about is people will be diaphoretic or sweaty when they're having a heart attack. And then the signs and symptoms can vary between men and women. As with men, women's most common heart attack symptom is chest pain, which we describe as angina, or discomfort. But women may experience other symptoms that are typically less associated with a heart attack, such as the shortness of breath, nausea, vomiting, and back or jaw pain. So our signs and symptoms in women are sometimes just not quite as obvious as they are with a man. All right, moving on. So most important, if you are having any of those signs and symptoms, we want you to call 911. So don't hesitate to call 911 if you're having chest pain. Minutes matter. I talked about the STEMI and the NSTEMI, and how the STEMI is the most critical, and we want to get you to the cath lab. So we actually have a lot of goals with our STEMI patients that are kind of set out there nationally, and then we have actually set our standard here a little bit higher than the national goals for a STEMI. And that's because fast action can save your life. When you are having a STEMI, the cardiac tissue is not being perfused with blood. So it potentially is dying. And we want to get that opened up as quick as we can. So the national goal, we refer to it as the door to balloon, or the D2B time, is to be less than 90 minutes. From 90 minutes from the time that you enter our emergency room door to the time that we open up that balloon in the cath lab. So that's why it's so important to call 911 if you experience heart attack warning signs. It's almost always the fastest way to get life-saving treatment, because EMS can diagnose if you're having a heart attack. They'll do an EKG on you and they'll start treatments before arrival to the hospital. Also, very importantly, they will call ahead and prepare the hospital for your arrival. And while you're on your way, they can start giving you medications, and they can provide you with extra oxygen if you need it, which most always we do put oxygen on you if you're having a heart attack. And then also to keep in mind, another reason why it's so important to call EMS and have the ambulance bring you here is because if your heart attack progresses and your EKG reading changes from not just ST elevation or ST changes, but to what we call a lethal arrhythmia, such as the most common ones you may have heard of in the general public, you may have heard of VTAC or VFib, or your heart were to stop, or you would experience cardiac arrest, then the EMS providers can perform CPR and defibrillate or shock you if needed. And your driver most likely will not be able to do this for you. And the most dangerous would be is if you're having chest pain and you decide to drive yourself to the hospital and something like this were to happen, causing you to have a car accident or potentially not make it to the hospital. So please, please call 911. We really, really stress that with all of our community education that we do, and any patients that have come into the hospital and are getting discharged because they've been in for an episode of chest pain. We just really remind them to call 911. So then moving on to some of the heart attack treatments. So I mentioned that the EMS can give you medication, and then of course you can also at home, if you're experiencing chest pain, you can take an aspirin, just chew up. It's recommended to take 3 of the baby aspirin or 1 of the regular strength aspirin, which is 325 milligrams. Just chew it up. And then also sometimes if you have heart disease, your doctor might have prescribed you some nitroglycerin tabs that you can use. You usually just put those under your tongue if you're having chest pain. And that actually helps kind of dilate your arteries, hopefully get a little bit of flow back and relieve a little bit of your pain that you're having. And then the thrombolytic medications, you probably wouldn't have those at home, so EMS or the hospital can start those. And in layman's term, you might have heard them called clot busters. So like your Brilinta or Plavix or some of the common names you might have heard. And then, of course, I talked about oxygen already. Everybody needs a little bit of extra oxygen if they're having a heart attack. And then once we determine that you are having a heart attack, and if it is a STEMI, we want to get you to the cath lab really quick, and we want to do a PCI. So there's another medical acronym for you that stands for a percutaneous coronary intervention. Layman's term is, you've probably heard of angioplasting or stenting. And this little picture over here kind of shows how they go in with the little wire and either pull that clot out or open up some plaque that's there in your artery. And then if when you're in the cath lab, they find that you have multiple vessels that are affected, they might refer you to a cardiothoracic surgery for what we call a CABG, and that stands for a coronary artery bypass grafting surgery or an open heart surgery. All right, moving on here. So then let's talk about some risk factors. So we have the modifiable risk factors over here and the non-modifiable. So everybody I'll start over here with the non-modifiable, because unfortunately we can't change our age, can't change our gender, family history we can't change, race, ethnicity we can't change, and really can't change if you've had a prior heart attack. But hopefully we can modify some stuff so that you don't have a heart attack. So the number one risk factor is hypertension. And then number two is high cholesterol, smoking. And actually, I pulled this off of the AHA site too, and they only had the top three risk factors bolded. But our cardiologist asked me to bold diabetes because they feel like, and they're seeing a really high prevalence of this. They actually feel like it's maybe moving up to replace smoking, like it might be the third highest risk factor. So then some of the other ones, if you have sleep apnea, if you're obese, if you're inactive, a poor diet, if you have any carotid or other arterial or vascular disease, if you have AFib, other heart disease, alcohol, drug abuse, some hormone therapies can put you at risk. And then if you have a disorder that causes you to have a hypercoagulable, which means your blood is like more tends to be thicker and clots easier. That's where they would want to probably have you on a blood thinner. And so again, here it says half of Americans, or 49%, have at least one of the top 3 or 4 risk factors. And so I did want to kind of weave my husband's story into this a little bit. And so that I can stop calling him my husband, I'll just say his name is Mike, and he did give me permission to talk about him. So he we found out a few years ago that he has hypertension. So he was probably in his early 40s when we first found out about it. Can't change his age, can't change his gender, he's male. But when we first found out about him having hypertension, we didn't really believe it because he didn't really have any of these other modifiable ones. He doesn't smoke, he's not diabetic, he's not obese, he's pretty active. He actually eats a pretty healthy diet, like he likes all his vegetables and fruits. And of course, we didn't really know if he had high cholesterol or not, but we kind of assumed he didn't because we don't eat a lot of red meat. So when he went to his primary care doctor for something several years ago, he said, well, the doctor said I had high blood pressure. So he said I should probably get a blood pressure cuff and check it at home. And me being a nurse and seeing, that he seemed healthy, I kind of didn't believe it. And I just said, well, a lot of people have what we call the white coat syndrome, and their blood pressure will be high when they're at the doctor's office or at the hospital. So didn't really believe it. I think we did go ahead and buy a blood pressure cuff, but we maybe checked it a couple of times and then just forgot that we had it. And then maybe a year or two ago, he had an accident where he cut his hand, and we went to the emergency room, cut his hand pretty bad with a saw, and his blood pressure was really high in the emergency room. And of course, once again, I just wrote it off as, well, he has this injury, he's in pain, that's why his blood pressure's high. And they really didn't, keep checking his blood pressure. So again, I didn't think too much about it. And then shortly after that, he came into the hospital, had a procedure. And when the nurse brought me back into the pre-surgery area, she said, his blood pressure is really high. And I was like, it is. And at first I was like, okay, well, he's got that white coat syndrome. But, as he's all ready to go for his procedure and sitting there, we're checking again, it's not coming down. And then after the procedure, it didn't come down. So that's when we kind of started to look into it a little bit more. And we'll kind of weave his story into some of these other slides. So we'll talk about what is hypertension and what is your blood pressure. So when your heart beats, it pumps blood to your blood vessels. This creates pressure against the blood vessel walls. This blood pressure causes your blood to flow to all parts of your body. So it's a good thing. We want a blood pressure. A blood pressure reading consists of 2 numbers. The systolic, or the top number, is the larger first or top number, and then the diastolic is the smaller or second number. And then this little chart shows kind of what your normal blood pressure would be: elevated, slightly elevated. Then when you get into the orange, we consider that high blood pressure or hypertension. And then the darker orange and red is definitely a little higher. So what does it mean to have high blood pressure? It's when your blood pressure is consistently too high. So after these 3 times with my husband, I started thinking, well, maybe he does have hypertension. So again, the normal would be on the top number less than 120 and the lower number less than 80. I think when he was in the hospital, he had some like numbers up in here, and I was just like, oh my gosh, I can't believe that your blood pressure is that high. So then again, what does it mean to have hypertension? So having hypertension or high blood pressure can hurt your body in many ways. It adds to the workload of your heart and damages your arteries and organs, such as your brain, kidneys, heart, eyes, over time. The effects of high blood pressure can be prevented or reduced if it's treated early and kept under control. So again, we're mainly talking about heart attacks here, but it can also, high blood pressure can also put you at risk for having a stroke, heart failure, kidney failure, vision loss, and sexual dysfunction. And then nearly half of American adults have high blood pressure, and many, like my husband, don't even know they have it. So the only way to find out if you have high blood pressure is to have your blood pressure measured. And for proper diagnosis, it's important to use an average based on 2 or more readings obtained on 2 or more occasions. Your healthcare provider or local pharmacist can check it for you. All right. And then let's talk about some things that can raise your blood pressure. So we all know high salt diet, alcohol, drugs, caffeine, obesity. And then again, with my husband, Mike, it's stress, I think. I believe that that's his main thing that causes his blood pressure to get high. So again, I would have expected it to be high when he was stressed and in the hospital or at the doctor's office, because he really doesn't like that type of stuff. But he also gets stressed about really unimportant stuff like me or the boys leaving the lights on, or turning the air conditioner down too low, or the furnace up too high. Or the other thing he likes to do when he's driving is he likes to watch everybody that's texting and get really angry about people texting, or maybe not using their turn signal or something. So just silly things he's getting stressed about. And that could be the same for anybody. So again, so we did buy the blood pressure monitor, and this slide kind of talks about, you know, where they can be purchased, pharmacies or online. I think we got ours on Amazon. And an automatic cuff style bicep or upper arm monitor is recommended. So there are some that are out there that go on your wrist, and I think even some on your finger. But the most accurate ones, again, are the ones similar to what we use here in the hospital, and they go on your upper arm. And then ideally, you should measure and record your blood pressure twice a day. Take at least 2 readings, 1 minute apart in the morning before taking your medications and in the evening before dinner. And again, you can go on the American Heart Association website and print these blood pressure logs out if you want. They're kind of nice because they've got these little columns. You can put the date and the AM and the PM readings, or of course you can just write it down on a regular piece of paper. And then your doctor really appreciates it if you bring it into his or her office when you come in. And then we'll talk about how to get that accurate blood pressure measurement. So this little picture, it's kind of hard to read the numbers, so I've got them listed out over here. So you want to get an accurate blood pressure reading. And first off, you should not smoke, drink caffeine or alcohol, or exercise within or before 30 minutes of taking your blood pressure. So number 2, you want to rest in a chair or sit in a chair with your left or right arm, whichever arm, resting comfortably. Sometimes we'll check, there'll be a little difference between the left or the right arm, so you might check both arms. And then you want to relax. You want to kind of sit like the guys sitting here with your feet on the floor. Arm can be up on the table or on the chair of the arm, but you don't want it above the level of the heart. And then you want to place the bottom of the cup at the bend in your elbow. And you also want to try to get it right on your skin, not over your shirt if possible. And then also there are different size cuffs. So you want to use a cuff that's the proper size for your arm, and your local pharmacist can kind of help you with that. But if you have a little bit bigger arm, you'll probably need to get a large size cuff for that. Because again, if you're using too small of a cuff, you're not going to get an accurate reading. And then lastly, you want to take 2 readings 1 minute apart. All right. Okay, so let's talk about some prevention guidelines. So you want to know your blood pressure. You want to have it checked at least annually, and if elevated, work with your doctor to control it. So we will talk about some medications on one of the next slides that you can be on for blood pressure. You might get prescribed for you. And then, so after we had determined that Mike had high blood pressure, one of the next things that happened was he had his blood drawn, and sure enough, he had high cholesterol too. So next is find out if you have high cholesterol. If it is high, work with your doctor to control it. And most people recognize the word statin for the drugs that will lower your cholesterol. So Mike did get put on a statin. If you smoke, stop. If you drink alcohol, do so in moderation. And you probably hear that, you know, red wine is the heart healthy alcohol to drink, but also just in moderation. And then find out also if you're diabetic. Follow your doctor's recommendations carefully to control your diabetes. And then you want to include exercise in your daily routine. All right. So then this kind of summarizes all the prevention tips. So again, first one is to prevent or control high blood pressure. Then you want to eat healthy, get quality sleep, be physically active. If you do all those things, hopefully you'll be losing weight. Try to stop smoking, control your blood sugar, manage your cholesterol. And if you do all those things, hopefully you will feel good and you'll be healthy living. But sometimes you do all those things and your blood pressure is still high. So you'll possibly be put on a blood pressure medicine. And these just list out some of the common generic or brand name, what we call antihypertensives. So we have our ACE inhibitors or ARBs, which the common brand names are Zestrel and Prenavil, Cozar. But the generic names would be lisinopril, losartan. And then we have valsartan or Diovan, which is used primarily in patients with heart failure. So they decrease the blood pressure, and again, they help with heart failure. But also be aware, all of these medications have similar side effects. They can cause dizziness because if they get your blood pressure too low, they'll make you feel lightheaded and dizzy. So be aware of that and check your blood pressure. Most all of them can cause a dry mouth. They can cause, if you do have face or mouth swelling, they say to go to the emergency room because that could be an allergic reaction. And a lot of them cause headaches too. And then some of the other ones are the alpha agonist, clonidine or catapress, beta blockers, we've all probably heard that, metoprolol, Lopressor, atenolol, tenormin, carvedilol or Coreg. And then we've got our calcium channel blockers. A lot of people recognize the medication cardizem, and that also helps with if you're in AFib. So again, they all decrease your blood pressure. The last drug class down here is a vasodilator, so hydralazine or apresyline. So again, those are just some common medications that your doctor might put you on. And then this is what you want to talk to about your medications with your physician. And they will tell you that they only work when you take them regularly. Don't stop taking your medications without consulting your physician. Take your medicine at the same time every day. And if you have a lot, it's a good idea to use a calendar or a pill box as a reminder. And then this is just shows how decreasing the risk or decreasing your blood pressure can help you decrease your chances of having some of these diseases. So just a 10 millimeter of mercury reduction in your systolic blood pressure can significantly reduce the risk of several conditions. So coronary artery disease can be reduced by 17%. Your risk of stroke can be reduced by 27% and heart failure by 28%. And that's really just a small reduction in your blood pressure. So that just goes to show that even small changes will make a big difference. You can manage your blood pressure and keep it in check by, again, not smoking, vaping, or using tobacco products, eating a heart-healthy diet, reaching and maintaining a healthy weight, getting regular physical activity, limiting your sodium or salt, limiting your alcohol intake, and taking your medications properly. All right, now we're getting to kind of some of the fun stuff that we offer here at North Kansas City. So we have a community outreach program that Michelle, who started us off, heads up. And we have these cardiac screening and education offerings that are free events. These are just some flyers. They can be found on our website. Some of the upcoming ones, we do them at the North Kansas City YMCA, the Northland Shepherd Center, Liberty and Gladstone Community Centers, Telemundo School District, at Hy-Vee Arena, and our Mid-Continent Public Libraries. And those health fairs include, again, free fasting lipid screening to find out your cholesterol level, blood glucose to find out if you're diabetic or at risk for being diabetic, and blood pressure readings to find out if you have hypertension. And then we provide a lot of education. On one of the first slides, we have that little Act Now magnet that we hand out. And then some of our upcoming dates, the September ones have all passed, but we have some upcoming ones in October, November. And at these events, we have nurses and pharmacists that are there that can answer your questions. And then also you can look on the nkch.org/class for more classes that are coming up in January and February. And some of those are at local churches too. And then we have some more upcoming virtual classes like this one. We have one in December that talks about busting holiday food myths and just how to stay healthy during the holidays. And then this little flyer up here talks about February being Heart Month. So we always have several events in February with these screenings. This was actually this past February. We had an event at Northland Shepherd Center and Gladstone Community Center. So look for those again next February. And then another thing that we're really excited about is we're starting a new support group. It's called Mended Hearts. The first session is actually next week, I believe October 2nd from noon to 1. You can attend in person or join online. If you attend in person, it's in the Berry Room, which is on the first floor of the pavilion of the hospital. And then join online on our website. And it's a support group for heart patients, family members, and caregivers. So if you're interested in that, I encourage you to look into that and attend. And then lastly, I want to talk about some screenings we offer at North Kansas City Hospital. So we have these heart disease screenings. So to see if you're at risk for developing heart disease, your doctor may recommend you to get a calcium scoring cardio scan. And it costs $50. It's just like an X-ray or a CAT scan. You actually can do it without your doctor even recommending you to do it. And that's another thing that Mike, my husband, did. He went and got this calcium scoring CAT scan. It detects calcium deposits in your coronary arteries. And this is actually something we did before we even went and talked to the cardiologist or had a office visit with the cardiologist. And his came back just slightly elevated. You really want to get a score of 0. You don't want any calcium deposits in your coronary arteries. And I think Mike's score was like a 10. So again, it didn't seem too high or anything, because I'd heard other people that it had scores like 1700 or 700, 800. So I thought, well, 10's not bad. But when we went and saw the cardiologist, he showed us where the calcium deposits were at, and they were all in the LAD, which is the left anterior descending artery. And that's actually what is referred to in layman's terms as the widowmaker. So the cardiologist that we saw said, also we hadn't started really addressed his high blood pressure much either. So with looking back at his hospital records, the cardiologist said, what I'm really worried about is he's got hypertension. And we're like, well, yeah, we kind of knew about that. And he said, and he's got the beginnings of coronary artery disease. So he got started on a high blood pressure medicine. And then when the lab work came back and his cholesterol was found to be high too, he got started on the statin. And we are now monitoring his blood pressure more regularly. And I'm also reminding him to not get so stressed about these little minor things that he gets stressed about. And then the other testing that you can have done is the carotid artery evaluation, and it costs $40. And again, your doctor may refer you, or you can just walk in and ask for it to be done. Again, it's just a non-invasive X-ray, looks and predicts the risk of future cardiovascular events like stroke and heart attacks. Your carotid arteries, if you're not familiar, they're the 2 arteries that go up the side of your neck. So they kind of come right off of the heart and go up and perfuse your brain. So if you've got calcium buildups in those carotid arteries, again, it will put you at future risk for a heart attack or stroke. So those are great, relatively affordable tests that you can have done, and you can have them done, like I said, without a doctor's order, or your doctor might recommend you to have them done. All right, I think we're wrapping up here. This is where we'll let you open up and ask any questions, or if we have any that have been entered in the chat, I'll kind of let Michelle chime in here too.
That was awesome, Kristi. I absolutely loved it. I thought the best information you had was about the different medications and how they work, and then how to take a blood pressure correctly. We do a lot of work in the community, and I don't know how many times people will sit down and to get their blood pressure, and they've just worked out, or they've got their legs crossed, or they immediately want us to put the cuff on their arm and, not just take a pause there. So I think that's really important information. And then additionally, that cardiac calcium scan is a wonderful thing. I just have a quick question that popped into my mind when I was talking, or you were talking with the carotid artery scan. I've heard that you can sometimes tell if there's possible blockage in one side or the other if you check your blood pressure in each arm and there's like a big difference between the two. Is that a wives' tale, or is that true?
I think that is true,
It is.
actually.
Okay. Yeah. Do you know what the point difference is? Is it dramatic, like 40 points difference? Or I know there's some, I'll have to look it up.
Yeah, I don't know. That's a good question. I'll have to look into that.
Yeah, I know that if there's significant difference in the left arm to the right arm, I think is what I heard. Well, I'll be quiet for a second and see if any of our guests have any questions, or if they want to put something in the chat.
Yeah, I think we had a couple.
Yeah. Let me see if I can get it to pop up.
Yeah, I see a question from Amy about, do you make an appointment for the test you mentioned at the end? You can, I believe you can, but I think you can also walk. I think Mike just walked into radiology, like in the main hospital, checked in and asked, said he wanted to have a calcium scoring test done. And then I don't think he really had to wait too long. But if it's not scheduled, you probably do have to, you risk maybe having to wait a little while before they can fit you in.
I scheduled mine online. If you Google cardiac calcium scan, NKCH, it'll take you to like a scheduling website. And I self-scheduled mine. And then that way I could pay my credit card information and stuff. I don't know, it felt easier to me, but either way would work.
Yeah, great. And one thing I forgot to mention is those blood pressure machines you buy at home. If you're not sure that it's accurate or not, you can bring it with you to your doctor's appointment, obviously, and they can compare it to what they get on their reading. But you also, if you don't have an upcoming appointment, can take it to your local pharmacy and they will check it and they can calibrate it too for you to make sure you're getting an accurate reading.
Yep, that's a really great point. Thank you for that information too.
Think what other questions people have had when I've done similar presentations for this online or in person, I guess, and we've had some questions. I think maybe that was the main one, was about how to tell if that blood pressure cuff was accurate or not. Can you think of any others, or we have any others in the chat?
I think that was wonderful. And as Kristi shared, we will forward this recording to you in the email that you signed up for this course. If there's somebody that you think needs this information, you can forward it to them, and they'll be in a YouTube format, so it's easy to watch, and then also on North Kansas City Hospital's YouTube channel. Please make sure to check out nkch.org/classes for all of our offerings, and we appreciate your time today. Thank you so much.
Thank you.